Shalom, Sisters of Israel. Welcome to Fruitful Possession. My name is Sister JEMIMAH from the House of Jacob. Today's class will cover COVID-19 and a COVID-19 article. And we're going to learn about what a PPE stands for, as well as some breastfeeding benefits. But before that class begins, I'd like to share some scriptures with you. I'm reading out of the 1611 King James Version Bible, and I'm sharing some scriptures with you. So I'm first going to Titus chapter 2, verses 3 through 5. That the aged women likewise, that they be in behavior as becometh holiness, not false accusers, not given to much wine, teachers of good things, that they may teach the young women to be sober, to love their husbands, to love their children, to be discreet, chaste, keepers at home, good, obedient to their own husbands, that the word of God be not blasphemed. So today's class is about sharing my talent. And I'm going to go to the book of 2nd Ezra, chapter 8, verses 8 through 11, just to go over what breastfeeding topics I'll discuss today. So 2nd Ezra, chapter 8, verses 8 through 11. And this is regarding breastfeeding. For when the body is fashioned now in the mother's womb, and thou givest it members, thy creature is preserved in fire and water, and 9 months doth thy workmanship endure, thy creature which is created in her. But that which keepeth and is kept shall both be preserved. And when the time cometh, the womb preserved delivereth up the things that grew in it. For thou hast commanded out of the parts of the body, that is to say, out of the breast, milk to be given, which is the fruit of the breast, that the thing which is fashioned may be nourished for a time, till thou disposest it to thy mercy. So all praises. That's a really great set of scriptures that I like to share regarding, labor and delivery and birth, and then breastfeeding. And I'm going to go on to the book of Sirach. These two chapters I'm talking about in the book of 2nd Ezra and Sirach are in the Apocrypha, and I'm just sharing these scriptures with you. So you'll hear it'll be called Ecclesiasticus or the book of Sirach. It means the same books, Ecclesiasticus or Sirach. And I'm reading it out of Ecclesiasticus chapter 39, verses 26 through 27. And it reads, the principal things for the whole use of man's life are water, fire, iron, and salt, flour of wheat, honey, milk, and the blood of the grape, and oil, and clothing. All these things are for good to the godly, so to the sinners they are turned into evil. So these are just some scriptures I wanted to share with you before the class starts. So I hope you enjoy it. Thank you.
The relentless surge in COVID cases is forcing some healthcare workers to make unimaginable decisions over who gets life-saving medical care. Many in the hardest hit areas are exhausted and afraid, and their hospitals now running out of room and resources. Megan Fitzgerald reports.
Tonight, hospitalizations across the country are facing a crisis like they've never seen before.
It's a feeling of dread because we know what is coming.
The country setting a record for hospitalizations on Friday, the 4th day in a row, over 60,000. In just the last month, COVID hospitalizations in Illinois have nearly tripled. ICUs are quickly approaching capacity. Medical workers scrambling to keep up with the surge, and doctors like Michelle Prickett say healthcare workers are at a breaking point.
Everyone feels like they ran a marathon and now we're being asked to do an Ironman, and we're just tired.
Hospitals across the Midwest are being crippled by COVID. In Wisconsin, doctors and nurses are now forced to prioritize care, and they're running out of beds.
I never thought as a healthcare provider that I would be in the position of trying to decide who gets life-saving medical care and who doesn't. That kind of stuff isn't supposed to happen in the United States.
Hospitals under strain from coast to coast. In Pennsylvania, an elementary school gymnasium is now ready to be an overflow hospital. In Montana, health officials say they don't have enough staff to support rural populations. Utah healthcare workers overwhelmed by patients are forced to activate their surge plan. calling on New York nurses they helped in the spring to help them now during their darkest days.
A battle is easier won together, and it is the circle of trust and support that has kept us going.
Nurses are now begging the public to help them, asking the country to cancel Thanksgiving plans.
We didn't sign up for an unknown pandemic with limited resources, and it's very selfish to make that decision when there are people working really, really hard to keep you safe.
A warning from the front line that quarantine fatigue doesn't compare to the exhaustion inside the ICU.
And Megan joins us now from Los Angeles. Are they considering any new restrictions there?
Well, Jose, the mayor says it's a possibility if cases continue to rise. California just surpassed 1 million cases, and here at Dodger Stadium, they're testing thousands of people a day to try and stop the spread. Jose?
Megan Fitzgerald in Los Angeles. Thank you.
Okay, so what does PPE stand for? P is personal protection equipment. And what are some examples of personal protection equipment? Some examples may include gloves, or a gown, or a mask, or a face shield, or a head covering, or a helmet, or something to cover your shoes when you're going to be exposed to some hazardous material. So I'm going to read this list to you. It says something about what forms you may see a PPE in. It says the different types of PPE include head and scalp protection, respiratory protection, ear protection, like in the form of earplugs, eye protection in the form of goggles, hand and arm protection, which would be in the form of disposable gloves, or gloves that are really long where it goes all the way up to your elbows, foot and leg protection, body protection, height and access protection. So you may see that in the form of gowns, disposable gowns for protecting the body, and hearing protection earplugs. When you're protecting the eyes, you would see goggles. When you're protecting the head, the face, or a scalp area, you would wear like a cap or a helmet for your head. And if you're protecting the mouth or the nose, you would wear a mask. You may even see someone with a face shield even though they have a mask on. So I have a cloth mask, but you may see these in the form of a disposable mask, which is helpful as well. So I'm going to show you how to put this mask on. As you can see, it's shaped where the point is at the top. So that's the way I would position the mask. I'm going to put it on. And I'm going to take it off. And that's pretty much it. What's good about these is these are reusable, so you will save money if you have the reusable mask. About COVID-19, and it talks about what healthcare providers are going through dealing with COVID-19.
First of all, what's going on in Texas, I don't feel like is being broadcast like they did in New York. Why, I don't know. The facility that I was at, they have surpassed New York, y'all. If y'all can imagine that, they have surpassed New York. What I experienced this past month there was horrific. I don't know. So, of course, okay, I was in El Paso, Texas. Of course, majority of the patients, well, just about all of them were Hispanic, which is a minority. For some reason, the doctors there did not aggressively treat those COVID patients as they should have, as I have experienced before. I was in El Paso, Nikki. I thought Cameron's gonna come over here. They did not aggressively treat them as they should have. And according to their staff, the doctors at the hospital wasn't aggressive before COVID, but even with COVID. So I saw a lot of people die that I feel like shouldn't have died. Y'all, that assignment there broke me. I was put in what's called a pit. And in this pit was 8 patients, all COVID positive, My first day of orientation, I was told that whatever patients go into the pit, they only come out in a body bag. Young. My one patient that I took care of for the whole 3.5 weeks I was there was 41, which is younger than I am. 41. We had a 29-year-old in there. We had a 31-year-old in there. And these patients was like sick. I've never seen so many colds before. I've been a nurse 13 years now, total. I'm used to when we run colds, we do everything we can. We exhaust all measures to save our patients. Anybody that know anything about CPR, 1 round is 2 minutes of CPR, which normally includes chest compressions and bagging them. The patients that we coded, we were not allowed to bag them because we would get too much exposure, which I hadn't seen. And because they were COVID positive, this hospital's policy was they only get 3 rounds of CPR, which is only 6 minutes. Out of all the codes that we had there, there's not a single patient that made it. Y'all, when I say this assignment here, like literally almost destroyed me. Like I called my husband from there, I called my best friend from there, and I just cried. And I just said, what I'm seeing here is just not right. And I kept saying, I was like, I can't get sick here in Texas. Because if I get COVID here in Texas and have to come here, I'm going to die. Like, it was that bad, y'all. Coming in with a hospital bed. So I'm thinking they're bringing us another patient. Y'all, the morgue was so full of bodies that they had ran out of room. So once the doors open to the pit, they come wheeling in a body already in a bag, lined them up with the rest of our alive patients because they had to store the body in there because the morgue was out of room. Hey, Liana, they've had to bring in freezer trucks because there's so many bodies. I was naive enough to think that maybe if I tell them to put me in the pit every day and I work with the same patients every day, continuity of care, maybe I can do something. Maybe I can do some good. Those patients were so sick, it was nothing we could do for them. Y'all, what I experienced as a nurse was horrific. I remember calling a doctor one night, and mind you, we as nurses sit in this pit for 12 hours. The only time that we in full gear, the only time we leave that room is if we go to the bathroom or we go on our 30-minute lunch break. I remember this man bleeding profusely, and I remember calling the doctors that was there. Y'all, to have a doctor tell me, we don't come in those COVID rooms, I'm like, what? Y'all, the doctors don't even step foot in those COVID rooms to see those patients. I was there almost a month. I never once saw a doctor come in that room because they were COVID positive. Doctors would not. We as nurses, it's okay for us to be exposed. But you as doctors, you do not even come in there. You can't get exposed, but we can. And y'all making all the money. Okay. Texas has surpassed New York. We had 4 freezer trucks. 4. They had to show up because it was so many people dying. Like you dread doing CPR on these patients because you know they not gonna make it. Y'all, I felt like I was tortured. Save any of those patients. Y'all, we got a 29-year-old patient in that pit, a 31-year-old patient, a 41-year-old patient. They are all younger than I am. I'm 44 years old. And to have the families call you night after night after night for an update, like anything was gonna be different, was horrific. to know that the only way those patients was coming out of that pit was in a body bag. And y'all, I have never experienced and have no words for what I just experienced in El Paso, Texas. If those doctors there would aggressively treat those patients from the beginning, a lot more would make it. Y'all, and the saddest part about it, my first night there, as I was getting orientated, the nurse that orientated me had one patient that was called the VIP patient. She was a doctor's wife. And when I say they pulled out all the stops for that woman, it wasn't nothing that they didn't do for that woman. And guess what? She was the one patient that made it out of that ICU alive and was able to downgrade to a long-term acute care. So you mean to tell me because she's a doctor's wife, her life meant more than any of those other patients that has been at that facility that had worked in New York that ain't said that? Why they're not getting that attention? I feel like they're not, because they're all Hispanic, they're all minority, and it's like their life don't matter.
And you can read this article on your own at www.nonprofitfruitfulpossession.blogspot.com. The disproportionate impact of COVID-19 on Black healthcare workers in the United States. This is an article dated back on May 14, 2020, and it's about COVID-19 and what Black healthcare workers are going through. It was a recent study just to give us more detail about the social, economic situations going on in the community. It starts, grieving families, social distancing, economic disruption. In many respects, coronavirus has changed the world, but it also has exposed the startling, consistent toll that catastrophe exacts from Black communities. The old adage that when white America catches a cold, Black America gets pneumonia.
Many Black people are dying of COVID-19.
But as a nurse of over 35 years, I am greatly concerned. I work in the healthcare field right here in the Washington, D.C. area, and I'm seeing a trend that I want to bring to the attention of my fellow Black Americans, Black Caribbean folks, Blacks of any kind or shape, wherever you come from, that I think you all need to be aware of. That is, for folks who are showing symptoms of COVID-19, our symptoms as Blacks are different. You don't have a cough, you don't have a temperature, yet our folks are dying at a higher rate than any other nationality or group. And that is because instead of a fever and a cough, what our folks are showing up with is what we in healthcare call malaise, or you just don't feel right. And on top of that, what happens is you start having either pain in an extremity or you just start feeling a little winded. Guess what? If this is happening to you, you need not to go lay down. The clock is ticking. This coronavirus brings on bleeding inside our bodies, whether it's in our extremities, in our hearts, or in our lungs, causing blood clots. And that's what's killing our Black folks. Now, if you can't get to a doctor, then you need to get up and walk. You need to start taking deep breaths as much as possible. Use some of your old home remedies. You know how your granny used to give you the garlic and the lemon and the ginger? Make yourself a poultice of onions. Put it on your chest. But it's by time that we start doing something for ourselves. We are losing our Black males especially, faster than the doctors and the lawyers can pick them up. And the reason for that is one of the symptoms that is very common among our black men is pain in the muscles. And guys, no pun intended, most men, when they start to have a pain of any kind, wants to lay down. This is not the time to lay down. If you lay down, your lungs is filling with blood. And when that blood starts clotting, you can no longer pass oxygen to your bloodstream. So I'm no major doctor, but I've seen too many die in the last couple of weeks like this. And if you really start thinking, you go back as far as February, where we started finding people in their beds dead. And it really seems like it's that virus that was already in our community. So black folks, don't get stupid because they tell you you got your stimulus check and you're going out to go get your hair done or your nails done. Please protect yourselves, not just for you, but for your family. Let us be wise about what we're doing. We know we're always the group they're ready to do experiment on, or the group that they feel is dispensable. It's time we start taking care of ourselves. Please pass this information on to your friends and families. We need to do better. We need to take care of ourselves. We need to make sure that we're getting enough rest, eating properly, cover your nose and mouth. But more importantly, if you don't have to go out, stay home. I have too many nurses who work under me who are now out because they've been infected. Healthcare workers do not want to do this. And it's not fair to ask them to give their lives when you're not doing your part. Let's stop the craziness. Let's show them that we are no better or no worse than anybody else. Please pass the message on. Let's stop the coronavirus dead in its tracks.
Has become a chilling reality. Recent data coming out of New York City, Chicago, and Louisiana indicate that deaths from COVID-19 are disproportionately high among communities of color, Black and Latino patients in particular. Though Blacks are only 22% of New York City's population, as of mid-April, they constituted 28% of fatalities from the virus. In Chicago, where Blacks are 30% of the population, they comprise 70% of those killed by COVID-19. In the state of Louisiana, Blacks are 32% of the population, but 70% of those dead from the disease. As some states move to reopen against the advice of public health professionals, these numbers are likely to get even worse. As we prepare for this, we should also begin asking another interrelated question. What impact will this growing death toll have on Black healthcare providers, particularly Black doctors and nurses? So I'm just going to go down and scroll. It says, as a sociologist who studies the experiences of Black healthcare workers, I feel that one unanticipated consequence of the coronavirus might be a setback of the modest advances the medical industry has made towards improving racial diversity among practitioners. Currently, despite being approximately 13% of the United States population, Blacks constitute only 5% of all doctors and 10% of nurses. So we're always going to need those nurses and doctors. Both professionals have come to realize that more racial and gender diversity is essential for providing care for a multiracial society, especially given data indicating Black patients' health outcomes improve when matched with a same-race provider. But conversations with Black healthcare workers about their daily experiences exposes the possibility that COVID-19 could be a breaking point, both physically and mentally. So I'm just going to scroll down the article. I'm not going to read the whole article with you, but it's a very good article. It has a lot of detail in it. I'll give you a little bit about the physical dangers Black healthcare workers face. In a recent study, I investigated the choices that Black practitioners made about where they wanted to work and what specialty of medicine they wanted to pursue. The 60 respondents in my study hail from a range of specialties including OBGYNs, geneticists, and anesthesiologists. Across specialties, I found that many were motivated to go into healthcare by a desire to help those who were least likely to access high-quality, compassionate care. So they wanted to go into it because of the lack of resources available to the community. All right, so it says, this could have led many of my respondents to seek out employment at facilities in urban areas where most patients were Black, Latino, and often low income and or uninsured. As many a nurse I spoke with for my research told me, Blacks are culturally a higher percentage of the poor. And so I just feel I take personal responsibility in making a difference. I'm really focusing on the culture who needs it the most and figuring out ways to reach them. For healthcare workers like Mindy, this choice means being on the front lines for patients who can't afford primary care physicians, use the emergency room for medical care, and often have extensive pre-existing conditions. All right, so I'm going to scroll down a little bit where it's going to talk about some of the mental health dangers Black healthcare workers face. My research indicates that the conditions under which many Black healthcare providers are working produces a specific kind of burnout, stress, and exhaustion. Frequently, this happens not only because many are working in under-resourced public facilities, but because they are also dealing with the racial implications of their work, caring for low-income patients of color, whom even many of their white colleagues view through a racially stereotyped lens as drug abusers, non-compliant patients, or irresponsible parents. As Eric, an anesthesiologist, told me with visible frustration, there were many times I saw patients shunned simply because of their skin color and problems they presented with that may or may not be present in our community. There's all sorts of anecdotal conversation from white doctors about, I know how those people are when you give them medications, so, or I see that all the time with this population. So it says, repeatedly hearing these accounts from colleagues presents a special challenge to these Black healthcare professionals. In addition to providing care to vulnerable populations, they are also put in a position of defending them from often unfounded stereotypes. So it's a really good article. You'll learn a lot from it. I hope you go on our website at www.nonprofitfruitfulpossession.blogspot.com to learn more about this article as well as some other valuable information. Or you can visit us on www.pinterest.com/nonprofitfruitfulpossession/pins. And you'll learn a lot about that as well. And although we are not affiliated with any other organization and we don't share any of their views, these articles and information is for educational purposes only. So I hope you enjoy. Thank you for watching. Okay, so I'm going to talk about a really good topic as well. It's called Properties and the Importance of Breast Milk. And I got this information on a website. It's free to the public. You go on www.cappa.net, capp.net, and you can learn more about that. And it has to do with properties and importance of breast milk. So what are some really good reasons why mothers should breastfeed their babies and why it should be encouraged by the family? Well, it says, breast milk is an anticipated outcome of birth for the infant. Every reflex, every need, every craving the newborn has is satisfied by breastfeeding and the natural behavior that accompanies it. Breastfeeding is how mammals feed their babies, and the human body prepares for this relationship from just 16 weeks of gestation. Its importance can be measured in a variety of ways. But just to look at the face of baby ecstatically, breastfeeding tells most of the story. Studies have shown that the more times breastfeeding is discussed, the greater the chance a woman will choose to breastfeed. As lactation educators, it is important that we encourage and support breastfeeding by talking to women about their concerns, as well as the influences that may affect their decision to breastfeed is encouraged. All right, so let's go on to that. What benefits will the baby have by breastfeeding? Well, it says protection against chronic diseases. What are some chronic diseases that we want to talk about? Well, diabetes type 1, which is developed during adolescence. You'll help to reduce the incidence of getting diabetes type 1 in that child. You'll also help to reduce the risk of childhood cancers, reduce the risk of childhood obesity. You'll also help to reduce the risk of atopic illness. You'll lower the overall infant morbidity and mortality rates, right? Like otitis media. Otitis media is ear infections. So you may notice, or you may know someone where their child was always getting a high fever and ear infections all the time, like every other week, every other month, they were getting ear infections and they kept going to the doctor. There's a high probability that the reason why that's occurring is because that child was not breastfed. So when you hear lower overall infant morbidity and mortality, that means things like otitis media, which is ear infections, gastrointestinal upset, which is like your stomach or your colon, your digestive issues. You may have some inflammation there. So that child may experience, I have a stomach ache, or I have something wrong with my colon, they have diarrhea or constipation or something. You reduce that risk because they are getting breast milk instead of something that was made, through a company. And you lower the incidence of respiratory illnesses because it has antibodies in it to help fight diseases. Exclusive breastfeeding through 6 months reduces the risk of SIDS. SIDS is sudden infant death syndrome. So of course, it's great if you could feed your baby up to 3 years, right? But it says if you just did it for 6 months, exclusive breastfeeding through 6 months reduces the risk of SIDS, which is sudden infant death syndrome. So you're going to want to look that up. A baby could be born completely healthy, and then the baby goes home, and then all of a sudden, sudden infant death syndrome. You can help to reduce the risk of coronary heart disease and the number of adults with high cholesterol. Now that's very good because that's like, is that the number one killer of, let's see where heart disease is. Let's find out the leading killers in the United States. Is heart disease the number one killer, right? The leading cause of death. It says, I just looked this up on Google. It says heart disease is the leading cause of death for men, women, and people of most racial and ethnic groups in the United States. One person dies every 36 seconds in the United States from cardiovascular disease. About 655,000 Americans die from heart disease each year. That's 1 in every 4 deaths. But if you breastfeed your baby, you will significantly reduce the risk of heart disease and the number of adults with high cholesterol. Reduce the risk of infectious diseases like sepsis. And sepsis, what kind of infection is a sepsis, right? Let's read that as well. Sepsis is spelled SEPSIS. It says sepsis occurs when chemicals released in the bloodstream. Sepsis occurs when chemicals released in the bloodstream to fight an infection trigger inflammation throughout the body. This can cause a cascade of changes that damage multiple organs systems, leading them to fail, sometimes even result in death. So if you breastfeed your baby, you are protecting your baby. You're helping that son or daughter live much longer. They can grow up in the community much more healthy. They don't go to the doctor. They can live a much, much longer life than the average person who's not breastfed. Which, if they have talents, they can go on and do so many different things because they got to live longer. So let's talk about increases effectiveness of vaccine coverage. If your children are vaccinated, all right, if they are vaccinated, it's going to magnify its effects to help protect them. In fact, you may find that there are a lot of children that don't need certain vaccinations because they don't really get sick. So reduces the risk of dental caries. Dental caries is just another name for cavities. So babies that are breastfed, up to the age of 3 or just as long as you can do it, you're going to help them reduce the amount of times they have to go to the dentist. They don't get cavities. Their teeth are stronger. They're healthier. They're thicker. They last a long time compared to someone who is not breastfed. It reduces the incidence of asthma. So it says reduces asthma deaths. So you just see all these improvements just because someone was breastfed. When you breastfed, you also reduce blindness and visual impairment in children under the age of 17. Breastfeeding patterns. In the first weeks, breastfeeding can take up a lot of your time. But as your baby gets better at it, it will take less time. You can also expect some clustered feedings. This is when he nurses frequently for several feedings and then takes a break before feeding again. Your baby will also have days when he eats more often. This usually lasts between 1 and 4 days and is a natural way of building your milk supply to meet his growing needs. The more you breastfeed, the more milk your body makes. So it's important to feed your baby often from both of your breasts. Offer both breasts throughout the day. Let your baby feed from the first breast as long as he keeps sucking and swallowing. If you need to remove your baby from your breast, gently break the suction by placing a clean finger in the corner of his mouth and over your nipple. Try to burp your baby. He may not need to. Offer the second breast, but don't worry if he doesn't take it. At the next feeding, start on the side that wasn't drained as much as the previous feeding to encourage healthy milk supply. Burping your baby. Burp your baby after nursing to get rid of any gas he may have swallowed. Burping is a great way for your husband to help out and spend time with the baby during feedings. Don't worry if nothing happens. Breastfed babies don't always need to be burped. Let's talk about how to burp your baby. Put a cloth under his chin in case of spit-ups. Hold him while he's sitting up in your lap. Support his chest and chin with one hand and gently pat his back with the other. Once your baby has better head and neck control, You can hold him against your chest with his chin on your shoulder. Avoid pacifiers. Early use of pacifiers can make it harder for your baby to breastfeed successfully and could reduce your milk supply. That's why it's best to stay away from them, unless there is a medical reason for it. Thank you for listening to this Fruitful Possession Health Tip moment. So now we talked about some things. I talked about some things that had to do with the benefits of breastfeeding for the baby. Let's talk about mom now. So if mom is healthy, the husband is ecstatic because his wife is healthy, his child is healthy. He doesn't have to take a lot of time off to, care for a sick child, a sick mother, use a lot of sick days when it's time for him and his wife and his child to bond. He can do that. So there's one more thing as well that I didn't read in the benefits of the baby. It helps to create a stronger bond between the mother and the child. So if you breastfeed your baby, you're going to have a stronger connection to your child. And you want that. You really do when you're teaching and training your child. To the mother, what are some benefits? Well, you're going to help to reduce your risk of osteoporosis, which is the deformity of a spine. Let's read about osteoporosis so you can hear some details about it, right? We know it's fragile bones. Your bones are real brittle, and it could just mess up all your bones. Let's read about it. What is it? Okay, so it says it's a condition in which bones become weak and brittle. The body constantly absorbs and replaces bone tissue. With osteoporosis, new bone creation doesn't keep up with the old bone removal. So you're gonna reduce that significantly if you breastfeed your baby without even taking a calcium pill. Even though calcium pills are very helpful, especially vitamin D3, things like that. That will help you, but you get this extra amount of protection by breastfeeding your baby. Reduces the risk of premenopausal breast cancer, ovarian, cervical, and thyroid cancer. That is 1, 2, 3, 4 different types of cancers that you reduce your risk of, right, when you breastfeed your baby. Protection against rheumatoid arthritis, diabetes, cardiac disease, hypolipidemia, that's just like elevated cholesterol, and hypertension, that's high blood pressure. You breastfeed your baby, it's like you're getting rewarded, by doing that, because you're doing that. It's going to really help you. Space pregnancy. So let's just say you just had a baby and you're breastfeeding. Well, it's like your body is naturally spacing out where you won't get have a baby right away. Let's just say that you won't get pregnant right away. It's giving you time to bond with your baby before you may have another pregnancy. Increases bond with the infant. Like I shared earlier with you, if you breastfeed your baby, you're gonna have a stronger bond with your baby because your baby's always with you. You're carrying your baby in a baby sling. You're not putting him in a car seat all the time. Your baby's right there with you. The baby was used to being with you when he or she was inside of you. And now you have your baby carried in your baby sling, or you have your baby in the back of you, or is always around. Reduces stress overall due to lactation hormones. Reduces risk of postpartum hemorrhage and aids in uterine contractions. So let's talk about the postpartum hemorrhage. So, after you have a baby, there's a series of you're bleeding. So there's phases where it's heavy at first, then it's going to taper off a little, and it's going to taper off some more as the weeks go by. So postpartum hemorrhage, it helps to reduce that. It helps to tighten things up down there, start to get you back to normal, and aids in uterine contractions. All right, so also, one other key thing too is, if you're breastfeeding your baby, you will lose weight faster. It says increases weight loss in first 6 weeks of postpartum. So that first 6 weeks or so after you just had a baby, you're going to lose weight faster than someone who's not breastfeeding, because you're going to burn a certain amount of calories just by breastfeeding. Hastens recovery of postpartum. It's going to help you heal fat. It's like healing your body. As you are breastfeeding, it helps to heal your body. And you know what? Another thing too, right after you have a baby and you begin to breastfeed your baby, like as soon as the baby comes out, you birth the baby is brought to your chest, you start to breastfeed. The placenta is still inside of you. If you're breastfeeding your baby, it helps to stimulate the placenta to detach from the uterine wall and to come down the birth canal. So what is the benefit to the family? The husband? What's the benefit to you? What's the benefit to the baby? The whole family, your other children? Well, it says you're going to save some money. You're going to always save some money. It says, well, how do you save money? Cost savings in form of like formula. You don't have to buy formula. So if you're going to just give your baby breast milk all the time, you don't have to buy formula milk. You don't have to keep taking your child to the hospital for healthcare visits because your baby's not sick. So they only really need to go for their checkup, maybe check with the doctor, through virtual appointments. Bottles, you don't need a lot of bottles. You can just feed on demand. You don't need to take the time for warmers, or you got to get those fake nipples. You less sick time from work. And how does that help the society? Well, in your community. Well, breastfeeding is green, which is true. Healthier children and families, which is true. You healthier. So if the child's not getting sick, nobody else is catching the cold in the house. So you got healthier families. Increases high school completion. See, just that alone. Just breastfeeding, not putting a lot of computers and things like that in front of them. Just that alone, right, helps them to complete. It will contribute to it, not just the other things of studying and reading. This can help as well, in addition to those things. Reduce physical assaults. I don't know what that means, but that's great. Reduce physical assaults. Reduce child abuse and increase family bonding. Yeah, think about it. Okay, think about it. Reduce child abuse and increase family bonding. When you're breastfeeding, you're always with your child. You want your child with you. You don't want them away from you, your baby, right? And so you're used to, okay, I gotta pick the baby up. I gotta breastfeed him, make sure he or she is fed. So it says reduce child abuse and increased family bonding. All right. So let me go on to some other ones. Increase the proportion of people with serious mental health illnesses who are employed. Okay. This is how it says it helps it to the society. Healthcare savings as well. All right. So I'm going to go on to what's the properties in the actual breast milk itself? What is the ingredients? I know you probably say, I hear about breastfeeding being great. Okay, you gave me some, pointers. It's going to really help my child. It's going to really help me. It's going to help my husband. It's helping the society. I'm going to save money. But I don't really know what's in my milk. Okay, I know it's good, but why is it really good? What is put in there? What do our bodies have in the milk? When you're breastfeeding? Well, I'm going to read this to you. This is from the same place. You can read it on that site, kappa.net, or you can go to another site and read about it as well. Properties of breast milk. It says breast milk is unique to each mother and baby. So one mother's breast milk is not the same as another mother's breast milk. It says breast milk is unique to each mother and baby. Like you hear a nurse, midwife, you hear a midwife or a doctor, OBGYN doctor say, or even another person, they'll say, you know what? Every pregnancy is unique. Your pregnancy is not going to be like mine, right? That makes sense, right? Because that person may be in labor for 12 hours. Another person may be in labor for a couple of days, or another one was in there for 5 hours, or this is her first pregnancy. This is their first pregnancy, the husband and wife, and then It may be another couple, a husband and wife, second or third child. So theirs is different. Their ages are different. You know, their lifestyles are different. It says it is species specific, age specific, and changes its properties according to the time of day, development of the baby, and even throughout the breastfeeding session. Breast milk is a living fluid that contains biologically active substances ideal for the human baby. Human milk is 99% bioavailable to human babies. This amazing resource that mothers create is truly the perfect food for babies. Human milk is designed for brain growth. High lactose levels with osmotic value to draw water into milk. So the milk has water in it too. So you don't have to think about, well, I give him breast milk, but so I got to give him water too. I drink water. The whole family drinks water. Is the baby getting water? The water is already in the milk. Humans have dilute milk meant to be fed often. Humans are meant to be skin to skin with their babies. They are not meant to nest their babies. So you see, we are supposed to have our babies skin to skin. The father holds the baby skin to skin. The mother holds the baby skin to skin. The baby wants to see both, all right? And we're meant to be that way. They are not meant to nest their babies, which means like don't put them in car seats all the time. Don't leave them way on the other side. Have them close to you. Have them close to you. So this is understanding the reality of artificial milk. So artificial milk is formula milk, and there's a huge difference. Formula is not a pure substance, so it means it's synthetic. All right? Formula can be contaminated, particularly powdered formula. Formula is associated with an increased risk in the infant of diabetes, obesity, otitis media, which is ear infections, and allergy. Formula increases the risk of rectal bleeding, and that makes sense because if you can reduce the risk of gastrointestinal disorders like stomach aches and colon problems and constipation when you breastfeed, if you give them formula food, it's going to upset their digestive system. So it says formula increases the risk of rectal bleeding, gastrointestinal reflux, right? Where you can't keep your food down. It's like kind of the acid's going up. Crying and colic. You said, what is colic? I know what crying is. I know what gastrointestinal reflux is. I know what rectal bleeding is. You're bleeding from your rectum, right? What's colic? Let's look up what colic is. That's very common in newborns. And colic is spelled C-O-L-I-C. So let's look it up. Colic. Infection. All right. What causes colic? Some experts believe that colic is a result of an allergy to cow's milk proteins. So cow's milk, it could be a contributing factor in formula-fed babies. So it says some experts believe that colic is a result of an allergy to cow's milk proteins in formula-fed babies. Less often, colic may be a reaction to specific foods in mom's diet in breastfed babies. So I'm going to read about that in another segment on breastfeeding, on some effects of what can happen to you, that you can transfer it to your baby through your breast milk. I'll talk about that during another class on breastfeeding. But let's go back to the topic today, which is properties and importance of breast milk. So we were talking about understanding the reality of artificial milk. So it says the DHA supplements in formula can increase risk of diarrhea, rectal bleeding, vomiting, bloating, and gastrointestinal distress. So let's read that again. The DHA supplements that they put in there's a DHA supplement that's actually added to the formula milk can increase risk of diarrhea in your baby, rectal bleeding, vomiting, bloating, and gastrointestinal distress. So as soon as the baby was born, the baby was healthy, but once you put the wrong thing in the baby, it starts making the baby sick. Formula milk can be used, but if you use it, you could, there'll be a lot of times where babies can experience bad side effects like this. Artificial milk lacks cholesterol and naturally occurring long-chain polyunsaturated fats, which is very needed. So now I'm just going to talk to you about specifically what are the ingredients in breast milk. So that's pretty much what I'm going to go over today, is what are some ingredients in the breast milk. And then we're going to talk about the stages of breast milk, what comes out first, what comes out second, and then I'm going to close. So ingredients in breast milk. Protection. Let's talk about that. Protection. Immunoglobulins, which helps to coat the intestines. It prevents pathogen emission, encourages growth of healthy bacteria. Lactoferrin, antibacterial, antifungal, and antiviral, promotes healthy intestines through encouraging growth of epithelium. Alpha-lactalbumin, anti-infective immunostimulant, forms Hamlet. Hamlet just means human alpha lactalbumin made lethal to tumor cells. Lysosome damages bacteria cell linings. Carbohydrates. So this is what the protection is against. I'm reading you a list of things that the ingredients in breast milk help to protect for. Carbohydrates, so that's in the milk. Carbohydrates are in the milk. Polysaccharides, which are prebiotic, they block receptors on epithelial linings, sweeping gut of bacteria. So it's going to clean the bad bacteria. Lipids, fatty acids, and monoglycerides attack toxins. So in the breast milk, there's also lipids in there as well, which are fatty acids. And what do those fatty acids and monoglycerides do? They attack toxins that enter there. It's going to clean it out. The milk also has cells and other components: neutrophils, macrophages, lymphocytes, cytokines, defenses, nucleotides, and much more. So you may not recognize all these terms. You can always look them up, but believe me, they're doing a great job, for the body. And let's talk about protein. The protein in human breast milk, so it has protein in the milk as well. So you're finding out, boy, you have several different elements in the breast milk that help. You have carbohydrates, lipids, you have lysosomes, you have lactoferrin, immunoglobulins. Then let's talk about protein. The protein in human breast milk changes according to the needs of the infant. So as the baby grows, like 1 week to 4 weeks to a couple of months, it knows it. Your body knows it, and it's going to change it based on the needs of the baby. It automatically knows. You don't have to think about it. Your body is just made to do those changes. The protein in human breast milk changes according to the needs of the infant. The amount of protein available to a prematurely born infant is different than that available to a term infant. A lactating mother's breast milk meets the specific needs of her infant. Human milk contains less than 1/3 the amount of protein in cow's milk. The protein in human milk contains both whey and casein. The whey is easily digestible and offers immediate nutrition to the infant. Cow's milk protein is mainly caseinogen, which is difficult for human babies to digest. The average ratio of casein to whey in human milk is 20:80. Though there is some variability according to age, whey protein contains alpha lactalbumin, serum albumin, lactoferrin, immunoglobulins, and lysosome. The latter proteins strengthen the immune system of the infant. So what's the functionality of breast milk protein? Well, it has essential amino acids, immunoprotection, carriers for proteins, carriers for vitamins. So what kind of vitamins? Folate, vitamin D, vitamin B12. It's got it in the breast milk. You don't have to give them a vitamin. Enzymes, growth factors. So carbohydrates, which is human breast milk, is relatively low in protein and fat, but high in carbohydrates. The main carbohydrate found in human milk is lactose. It provides about 40% of the calories in breast milk. Lactose, a disaccharide, helps promote the growth of lactobacillus bifidus. It also helps the infant absorb calcium and provides energy to the baby's brain by changing into galactose and glucose. It has fats. Your breast milk has fats, minerals, vitamins in there as well. That does a lot of wonderful things, as well as enzymes. So what are some contraindications to breastfeeding? Well, the infant whose mother has been infected with the HIV virus, right? So this, I'm going to read this again to you because this may not be clear. It says, what contraindications to breastfeeding? The infant whose mother has been infected with a human immune deficiency virus is taking antiretroviral medications, has untreated active tuberculosis, is infected with human T-cell lymphotropic virus type 1 or type 2, is using or is dependent upon an illicit drug, is taking prescribed cancer chemotherapy agents such as anti-metabolites that interferes with DNA replication, and cell division, is undergoing radiation therapies. However, such nuclear medicine therapies require only a temporary interruption in breastfeeding. The infant who has galactosemia, okay, and it says, make note that there are some conditions such as PKU, which may necessitate partial formula feeding. So let's look up what PKU stands for. So you want to get used to looking up things. You might hear things from the doctor, and there's a lot of information that they give you, but I'm just gonna read a little bit about it. It says they do a blood test. It says blood tests from babies healed done 1 to 2 days after birth can detect PKU. And what is PKU? A birth defect that causes an amino acid called phenylalanine to build up in the body. While the U.S. screens newborns for that, most countries don't. So I say this condition is very rare. Chronic, it can last for years or be lifelong. Treatments can help, but this condition can't be cured, so there's no cure for it. It requires a medical diagnosis. Lab tests or imaging always are required. All right? So last thing I'm going to talk about is the stages of breast milk from the time that the baby was born. So once you birth your baby, once you get to the stage where you're almost in labor, you get ready to have your baby, or you're going through a prenatal class and you're saying, okay, I'm learning about the different stages of milk. You're going to hear about the different stages of breast milk. But once you have your baby, this is what you're going to see. So the first milk that you're going to see from the baby from your breast to your baby is called colostrum. Colostrum, this is the first milk synthesized through lactation during pregnancy. It is the first milk a baby receives upon birth, which gradually changes from transitional to mature milk. Colostrum is a low-volume feed. It has less glucose than mature milk, but it is ketogenic. The ketogenic effect of colostrum allows infants to metabolize their extra glycogen stores until mother's milk supply increases. It is referred to as the liquid gold because of its dense, rich yellow gold color and its abundance of immunity strengthening properties. This milk protects the infant with its antibodies of immunity strengthening properties. This milk protects the infant, this milk protects the infant with its antibodies and long-chain polyunsaturated fatty acids. Colostrum has high protein levels, which help maintain blood sugar levels, giving the mother-infant diet time to learn how to breastfeed. Colostrum is rich in secretory IgA, lactoferrin, vitamin A, and sodium, but has lower concentrations of fat, lactose, and vitamin B1. Colostrum has a laxative effect on the infant and allows him to expel meconium from his bowels. Let's look at what meconium is, because that's that first bowel movement. It's really dark. It's sometimes looks like it's dark green or black, but let's read about it. That is the first bowel movement that your child will have. So let's look at meconium. And you have to get used to looking up these words. Okay, here we go. Meconium is a thick, green, tar-like substance that lines your baby's intestines during pregnancy. So when your baby's inside you, this is what's occurring. Typically, the substance is not released in your baby's bowel movements until after birth. Sometimes that may happen, where it may happen before then. However, sometimes the baby will have a bowel movement prior to birth, excreting the meconium into the amniotic fluid. Colostrum has a laxative effect on the infant and allows him to expel the meconium from his bowels. It is also rich in epidermal growth factor, which primes the intestines for the receipt of mature milk. Colostrum also seals the gut lining to provide passive immunity and protect the gut from pathogens and allergens. Whole proteins. Transitional milk. So that's the second one. The colostrum is the first, and it's thick. It's that golden milk, right? They call it the liquid gold. And then after that, transitional milk. So this is the milk that is transitioning into mature milk. Not completely colostrum, not quite mature milk. It's in between. The colostrum changes to transitional milk as the milk comes in during lactogenesis 2. This generally occurs around days 2 to 4 postpartum and lasts until 10 to 4 days after birth. So 10 to 14 days after birth. So this transitional milk from the colostrum milk to the true milk, it lasts between 10 to 14 days. Mature milk, it says mature milk. Transitional milk gradually changes into mature milk between about 10 to 14 days after birth, postpartum, and lasts until the weaning process. Mature milk is lighter in color and texture. Mature milk contains all the properties listed above and components of breast milk. Involutional milk. Once a couplet starts the weaning process, you're probably saying, what is the weaning process? This is my first baby. I never heard of weaning. I don't know. And, my grandmother's not around. I don't know. Or I could find out, but I want to know now. So you're just tapering your baby off of your breast now. They're going to start table food, and you're just going to, you're starting to wean them away from breastfeeding, but I'll look it up for you. Weaning. Let's say weaning off. Okay. It says to make something or someone stop doing or using something, right? But usually just wean the baby off the milk. That's what that means. Okay. So let's see. Mature milk is higher in color and texture. Mature milk contains all the properties listed above and components of breast milk. Involutional milk is another type. So we went over colostrum, which is the first milk. That's the liquid gold. Then there's a transitional period that lasts between 10 to 14 days. Then the mature milk is coming in toward the end of the transitional milk, right? And then we're talking about involutional milk now. Once a couple starts the weaning process, the breast begins to involate. Due to the lower demand from the infant, the volume begins to decrease. So the volume of milk starts to decrease now, thus changing the composition of the milk. The milk is categorized by low lactose content and higher concentrations of protein, fat, and sodium. So pre-milk, post-milk. Let's talk about that, pre-milk and post-milk. Pre-milk is the milk in the ducts before a feeding. Post-milk is the milk left in the ducts post-feeding. The literature in the past has defined milk as the milk in the ducts at the beginning of a feeding and hind milk as the milk in the ducts late in a feeding. Research, I'm going to talk about some recent research, right? It's turning up evidence that the longer milk rests in the ducts, the more the triglycerides in the milk have a chance to break down. This generally causes the milk at the beginning of a feeding to be lower in content. Thus, first comes skim, then the cream. However, when mothers tune into their baby's natural instincts and feed their baby on cue, there does not seem to be as much change in overall fat content between fore and hind milk. The largest change in fat percentage between early and late milk during feedings occurs when feedings are spaced at longer intervals throughout the day. Longer feedings do not necessarily equal higher fat content in milk. Most mothers do not need to do anything other than follow their baby's feeding cues. When a baby does need more calories, more frequent feedings and breast comprehension. When a baby does need more calories, more frequent feedings and breast compressions are effective ways to maximize energy intake.
We want moms to keep their milk and breastfeed their own children.
For Danielle Atkinson, the issue is personal. The mother of 4 breastfed each one of her kids, and she's concerned now that an Oregon-based company, Medilac, may be profiting off the breast milk of low-income mothers of color, specifically in Detroit. Atkinson's group, Black Mothers Breastfeeding Association, alleges Medilac is buying breast milk from these women at $1 an ounce and selling the milk to healthcare providers at $4 an ounce. The mothers feel Medilac's program may be exploiting the milk of poor Black mothers.
So we really want to hold Medilac accountable for the decision and the choice that they're putting in front of women.
We're deeply concerned that our women will be coerced into diverting the milk that they would otherwise feed their children.
So tell me why Medilac would target low-income Black mothers. Why would they do that?
That's exactly the question we're asking. Why is Medilac targeting low-income Black mothers when we know that there's so many issues here in the city with low-income individuals and breastfeeding rates and infant mortality rates? Why would they come to this city to ask moms for more when they're giving all they can to their kids right now?
We have never set out to actively recruit African American women in Detroit. We have donors of all backgrounds from across the country. We have no financial interest or vested interest in recruiting donors in that way, other than providing more community services to them and more support to that group to help increase breastfeeding rates.
Providers of Medilac's milk tell Action News with the co-op program receiving breast milk from 1,000 members in 47 states, the allegation of exploitation is simply false. Mothers like Atkinson say moms should keep their breast milk for their own children. Andy Choi for the Now Detroit.
So I hope you enjoyed today's lessons, and you can always visit us on www.nonprofitfruitfulpossession.blogspot.com, or you can visit us at www.pinterest.com/nonprofitfruitfulpossession/pins to learn about healthcare related topics. Of course, we are not affiliated with any other organization, and these classes are just for educational purposes only. So I like to say, all praises to the Most High in Christ blessed. Shalom.